So people ask me how I deal with the Lynch syndrome and as it pertains to the kids. Um, well, obviously, I'm a big proponent of genetic testing because I do think the genetic component is a significantly larger piece than it's made out to be. Um, but also, once you know the genetic component and you know what you're up against, you know how to fight it. You know how to screen for it. You know how to get early detection. So, the rule of thumb in cancer is that you, as the child, get screened 10 years younger than the parents. So, again, going back to 1997 when I was 29. So now my kids are aging. And of course, it's strange to think about it that they've only known me as a survivor in both senses of the word. But that's the reality. So my 18-year-old, who is our oldest, his job this year was to get into colleges, which he did. We're very proud, but also to get his genetic testing done. It was never a question. But we wanted to wait until he was 18, and so did my genetic oncologist. So he was tested, and sure enough, he does have Lynch. Another reason for my wife to be mad at me. And he had his first colonoscopy at age 18, just literally a few months ago, and thankfully it was positive. But this is the same time frame, positive in that it was clear. But the 14-year-old will have the same thing when, assuming the time frame doesn't change, when he turns 18, and then of course the 10-year-old when he turns 18. Again, all assuming the time frame doesn't change from my benchmark of age 29. But it's interesting is that I know a lot of parents who are grappling with the concept of talking with their kids about Lynch and also how to go about getting them screened, because they want their kids to get screened, but do they want to wait until after they're 18 when there's a chance that the kids don't want to do it? Or do they get it done before they're age 18 when theoretically they can make the decision because the kids are minors? So it's interesting is that that's kind of one of the newest segments of my journey is becoming this person that people go to who have Lynch and now have kids that are getting old enough to get screened or should get screened, either for the genetic component or even having a colonoscopy, because it's obviously getting younger and younger. And it's stuff you don't think about.
For an interactive tool to learn more about your colon cancer and your personalized treatment options, go to mycoloncancercoach.org.